Town Hall is one in a series that will be held across West Virginia. The first one was held by our partners in Wood County last week. It was both inspiring and informative. We are excited to announce that we now have 5 regional groups working on this campaign in Cabell, Wood, Kanawha, Barber, and there's 2 in Kanawha. And we aren't stopping there. The purpose of our campaign is to work towards a future where West Virginians don't have to struggle and suffer without adequate and accessible health care. Since the campaign started in January and with incredible community support, we have made a number of significant strides in that direction. We hope to make even more progress throughout this year and into the next session. We're here tonight to let you know what we've been working on, what we hope to do, and provide opportunities for folks who would like to get involved with our efforts to bring affordable and accessible health care to every single person in West Virginia. Most of all, we want to hear from you. We invite you to reach out and share your ideas on our healthcare agenda and share your personal stories. And this way we can all bring positive solutions to helping everyone get this affordable health care. To do this, we need a coalition built by committed organizations and individuals. Many of our groups have worked in health-related issues and policies on behalf of West Virginians for years. These include West Virginia Citizen Action Group, Healthcare for All West Virginia, the West Virginia Center on Budget Policy, and West Virginians for Affordable Health Care. And of course, our state campaign and its local affiliate here in Cabell County, Healthcare for All. Our panelists this evening come to you from across the healthcare spectrum, from local activists to healthcare policies to consumers just like you. I want to introduce Savannah Lyons, Co-Executive Director of West Virginia Citizen Action Group, to explain what the Healthcare Campaign for All is about.
Savannah, I think maybe you have your phone muted. Savannah, can you just unmute your line and then we'll be able to hear you?
So sorry about the silence there. This is Savannah Lyons with West Virginia Citizen Action. I'm really excited to talk about this campaign. It's personal to me because I went without health insurance for a period of time, and also at one point was paying up to 20% of my income for health insurance and healthcare. And as a young entrepreneur, I saw what a challenge that is to try to balance growing a business and also struggling to having to say no to the healthcare that I really needed. So this is personal for me. I'm grateful to everybody who's listening tonight. I'm grateful for Kim and the other folks involved in this project. And I'm going to talk about the campaign, but first I just want to give a little plug. We're going to be asking you some polling questions later on tonight, and you're going to have an opportunity to answer through your phone. You'll be prompted if you're on the phone. You'll have an opportunity to enter your answer through your phone, or you can also visit our website to weigh in, which is the healthcareforallwv.com website, or you can comment on the Facebook live stream, and we're going to be looking at that to see what folks had to say. And one person who answers the questions that we're going to be asking tonight will have a chance to win a $15 gift card, which will be randomly chosen. So hope you'll answer those questions. And but now I'm going to talk about the campaign. So the Healthcare for All West Virginia campaign is about making healthcare affordable and accessible for every single West Virginian. We believe that healthcare is a human right, and we believe that people matter more than profit. And we know that a world is possible where everybody gets the care they need. And so what we're doing is we're pushing a bold agenda of changes that we can do at the state level to get there as soon as possible. It's going to take all of us to make this happen. And it's going to mean listening and talking with our neighbors. It's going to mean telling our personal stories. It's going to mean meeting with our elected leaders all year round. It's going to mean holding candidate forums and getting candidates to say out loud that they will stand with uninsured people, people using Medicaid, and all of us who are struggling to afford what we need. It's going to mean showing up at the Capitol. It's going to mean showing up in our communities for our neighbors and our friends and our family members. And it's going to take you and me and every single one of us. And that's what this campaign is about. So now we're going to talk about the local work that we're doing in the Cabell County areas and the surrounding counties. But I hope you'll stay tuned in because you're going to hear about some really cool stuff that we think is possible next year, some good news, and also some good news about what we accomplished this year. So I'm going to pass it off to Bonnie, who's going to talk about healthcare for all in Cabell County.
Hi and welcome. So Healthcare for All Cabell County has been really busy since the beginning of the year. We have been fighting hard and lobbying hard for legislation, and you're going to hear the details about that in just a couple minutes. We've also set up a Facebook page, Healthcare for All Cabell County, with the link here in the comments, and we hope that you visit and stay up to date about events and information from that point. We've also been collecting important healthcare experiences and stories from our community members that will help us shape the direction of our campaign and the policies that we support. A big thank you to everyone who's already filled out our survey and shared their stories. We couldn't do it without you. We'd really love to hear from you. We've got the Health and Wellness Emergency Response Survey that we need you to fill out, and there's a link there in the chat. And we're planning a candidate forum on healthcare issues this summer prior to the election so that people can make informed decisions at the polls and support the candidates that commit to our mutual goals and your family's needs. And to show how important those stories are, we're going to move on to Kim, where she's going to tell a personal story.
Thank you, Bonnie. We all have reasons for getting involved with this campaign, and my reason is my daughter, Katie. She was diagnosed with a connective tissue disorder when she was 3, and then she was diagnosed with type 1 diabetes when she was 7. And she goes through a lot. I mean, as her mother, it's really challenging for me to see her, struggle with the pain and fatigue and stress. But unfortunately, when you have chronic diseases and healthcare issues, it's amplified by the fact that getting the care that you need, meds, supplies, doctor's visits, therapies are so outrageously expensive, even for people who have insurance. So my motivation to see major changes in the healthcare system started with me trying to get her healthcare needs met. I don't think anyone should have to feel the anguish and the constant anxiety of not being able to afford the healthcare that they need. This is my 3rd town hall on healthcare. The first one that I went to was in the months before they passed the Affordable Care Act. And Nick Rahal came, and it was a very heated conversation because you had people who were for it and you had people that were against it, and they were really, really both very passionate. And at one point during the town hall, it kind of occurred to me that despite all of the conflicting viewpoints, they were all saying the same thing. They wanted access to high quality, reliable, affordable health care for their families. They want their families to be safe and feel secure, and they don't want to have to lose everything they worked for their whole lives because they got one illness. So the second town hall, healthcare town hall I went to was with Joe Manchin. He came after the most recent election, and they were trying to dismantle the ACA. And a friend of mine, who I didn't know at the time, Jeanette Rousey, read my story at that town hall. And when she was finished, Joe Manchin said, "Can I get a copy of that?" And after the town hall, he came up to me and asked me if he could share it. And I said, yeah. And what was interesting is that, our story is not that extraordinary. millions of people in America have the same problems we do. They have exorbitant, tragically unaffordable health care needs. And I think the thing is, the power of the story is this is just a view into one family that you can kind of relate to. And it seems like we see so many statistics on healthcare, and that's kind of a wash. But it was very powerful to me that the U.S. Senator thought that our story was important enough to defend the Affordable Health Care Act. That's when I realized how important our personal stories are. So we don't have the influence to change national laws overnight. We know that. But with the successes that we saw this last legislative session were really, really inspiring for us to realize how much we can change on a state level. And what we've seen in the past few years is that if one state does something and changes their laws, other states can follow. We saw that with the public employee and teacher walkouts in West Virginia. You know, we did it, and then state after state after state followed. And Colorado was actually the first state that capped copays on insulin. And we, you know, other states followed. They inspired us. So everybody, I think, in West Virginia knows by now that economic justice doesn't rain down from the rich and the powerful, at least not until it's expected and demanded by the workers. It's our responsibility to educate our representatives and let them know what our communities and families need. And that's what we did. And that's what I learned working on the Insulin Affordability Act. We cannot afford to just sit back and abdicate that responsibility and just hope that our representatives will act in our interests. We've got to tell them what we need and tell them how to get it. And this is where advocacy and community organizing comes in. When we were working for the Insulin Affordability Act, hundreds of people brought their commitment, work, and talents to the table. There was something really magical about it, like the right people were in the right place at the right time. And everybody from the delegates who wrote the bill to the hundreds of people that called and emailed to support this bill. And many of us did things that were outside of our comfort zone. Like for me, it was public speaking. For other people, it might have been engaging their representatives. But we found that there are a lot of challenging things that we were capable of doing for the love of our families and the people in our community. And advocacy is an act of love. And there's no telling what any person might be capable of under those circumstances. So we welcome you to join us. It will take all of us to get this done. And speaking of personal stories, here's Brooke's personal story.
Hello, my name is Brooke. I'm talking about challenges in Medicaid support during COVID-19. Overcoming obstacles is what West Virginians do daily, even outside the recent global pandemic we are all facing. My daughter Willow was one of 20 babies born at CAMC on April 7, 2020, during the pandemic. As the third child of this family of now 5, Medicaid provided insurance coverage for my whole pregnancy cost, and Willow was automatically signed up for a medical card. There were pros and cons to having to give birth during the statewide lockdown for COVID-19 pandemic. I feel like it could have been better. The nurses were stressed and seemed to be on edge because of the virus, which is understandable, but the experience was overall different. West Virginia for Affordable Health Care, the Health Care for All campaign, and I are grateful for essential employees and medical professionals who are keeping our families safe during these challenging times. While I had to wear a mask during my stay, which was not normal, I also paced back and forth in my room because I was not allowed to walk around the hallways. And my husband Daniel was the only visitor that I could have, and I took to heart the trying times. I liked it in the way that I didn't have to entertain people and shower for other people, and I think some other mothers honestly might be able to emphasize with that comment. That it was just different. When things are normal, I work full-time at a local credit union in the West Virginia, Charleston area, and I provide for the family the best I can with a 40-hour work week. For a family of 5, as my husband, Daniel, studies to become a barber, Medicaid fills in a vital social support program for my family. Not only did Medicaid cover the birth of Willow, but it also has provided life-saving treatments for Brody, my son, who has cystic fibrosis, covering the doctor visits, which are now telemedicine visits. He hasn't even been able to go to his regular visits. A nebulizer, a vest, nutritional supplements, just so many things. Medicaid is helping my family stay healthy physically and helps us prepare for our future from a financial perspective. I don't have any idea how much these medical bills would have cost without Medicaid, but I'm sure I'd have a lot of them. And without this health insurance coverage, I don't know. I don't know if I wouldn't be able to afford it. With the opening of the country, a newborn child and two young boys, one with cystic fibrosis, it is stressful. My husband Daniel is studying for a profession which was closed during the pandemic, and as I got back to work, I think right now I can keep Brady safe, but if they open up the country, am I supposed to just keep him in the house? What do I do? Do I send him out in the world and risk everything? Making these difficult decisions are not just part of my family, but hundreds of West Virginia families. Medicaid will be there to support us as we continue to do our best to raise our children in a healthy environment during the challenging times. Let us continue to advocate and protect this life-saving and life-giving programs and policy, elections, and by sharing our healthcare stories. Thank you.
Hi, I'm Eve Markham Atkinson with Healthcare for All Cabell County. Healthcare is an important issue to me because I am a West Virginian with a chronic disease that leaves my immune system a bit vulnerable, so I know the importance of access to proper health care. What is your healthcare story? I'm going to ask a few questions. You will have a little time after each question to think about them. If you would like to share your response, you can put it in the comments section. First question. Are you or anyone you know currently struggling without health coverage or with unaffordable coverage? Second question. How is this affecting your or their physical health, mental health, financial security, or quality of life? Third question. Do you believe that everyone deserves access to affordable health care and coverage? And why? If you would like to share more of your concerns or your personal healthcare story, contact us at healthcareforallwv.com or dial *3 to be connected to an operator.
Great. Thank you, Eve. I'm going to move us on to talking a little bit about some of the wins that the Healthcare for All campaign had this year. I'm proud to be part of this campaign, not just because it's important, but because we're winning, and winning is important. Earlier this year, we passed not one, not two, but 3 top priority bills, and we also did some really important healthcare defense work. These bills were part of our 2020 health agenda, and you're going to hear a little more later about what we're thinking will be on our 2021 health agenda, which is what we're building towards right now. But I have to say, seeing the organizing effort and all of the volunteers and advocates who did work to get these 3 bills passed, it was really awe-inspiring for me. And I want to share that experience with you. I got to see people flood the Capitol with phone calls, letters, events, and lobby visits. And I got to see personally impacted folks like you and like me and like all of us on this call working with legislators on both sides of the aisle to build strong coalition around healthcare issues. And some of us helped organize a bus trip to Canada. I'll talk more about that in a minute, drawing attention to skyrocketing drug prices in the United States. And other people who are part of the coalition helped organize an ice cream social at the Capitol, where they entertained lawmakers, from both sides of the aisle, to draw attention to the struggles of West Virginians who have disabilities. And hundreds of West Virginians joined together in asking legislators to choose people over profit when it came to healthcare policy, and it actually worked. So thanks to these advocates, who were all people just like you and me, the coalition won the fight to provide dental coverage for Medicaid. I'm old school, so I'm going to use some signs here. And this is something I'm really proud of, that our coalition, when this goes into effect and we have dental coverage for Medicaid, which is going to happen this summer, 300,000 more adults are going to have access to dental care. That's preventative dental care. So they won't have to suffer the indignity of getting teeth pulled or going to the hospital with expensive bills for abscesses. They'll be able to have their teeth cleaned and have cavities filled before it's too late. Big win for preventative care, big win for all of us, because it's hard to get a job when your teeth hurt or when your teeth are missing. And a lot of folks have said this to us. So congratulations to everybody who worked on this and all the folks on Medicaid who came and made their voices heard in the Capitol. And congratulations to all of us, because this is a huge win. Also, people like you helped win the fight to clear the IDD waiver waiting list. This was something that we know was at the top of Governor Jim Justice's priority list, and that was because of us. That was because of people like us making our voices heard. And if you don't know what this is, it was a waiting list for people to be able to receive home and community-based services, people who have intellectual and developmental disabilities. And there was an outpouring of citizen action at the Capitol, and the legislature set aside $19.8 million to support these families. They were able to get 1,084 people off of the waiting list who have been waiting to receive these services. And so that means those folks don't need to be institutionalized. They can actually get care at home. And that's a huge win for those families. And another win we had was in the fight to reduce the cost of life-saving insulin. And this is a big issue for a lot of folks in West Virginia. About 1 in 8 West Virginians suffers from some kind of diabetes. And we passed a bill to cap insulin copays at $100 for a 30-day supply. It wasn't as low as we wanted, but we were really proud to get that win. We're going to keep working on it. And the price of insulin, which is made by only 3 manufacturers in the United States, has more than tripled since 2007. I know Kim has really experienced that through her daughter who has diabetes. And winning a copay cap was a huge step in the fight to make life-saving prescription drugs more affordable for all of us. So congratulations for all the folks with diabetes and their allies who came to the Capitol and worked on this bill. It was a huge win, and it was because of us. Guarantee it. And one thing we worked on that's been important for a long time and will continue to be important is defending Medicaid. There was a bill to enact work reporting requirements on Medicaid, which might sound like a good idea, but it doesn't work very well in practice. It could have led to 37,000 people losing their health coverage. Now just imagine if 37,000 people had lost their health care coverage just as we were going into a pandemic, the impact that would have had on our communities. Medicaid is so important for so many people in our state, like Brooke, who you heard from earlier, and we need to keep defending it. That's an ongoing battle. So thank you to all the legislators who supported that work, again, from both sides of the aisle, and thank you to all the advocates who made this possible. It wouldn't have happened without you. And we're all going to talk a little bit more about the insulin fight, but I want to just tell you a little bit about what happened. So we had a caravan to Canada, an insulin caravan to Canada. It was initiated by folks with diabetes, and Delegate Barbara Evans-Fleischhauer put a ton of work into organizing this. And the idea was to see how much money some people have gone to Canada and saved up to 90% off of insulin costs, because insulin is so expensive here in the United States and so much less expensive in Canada, where they have national negotiation on drug prices. And so this is an example of how organizing year-round and doing things when the legislature is not in session to build awareness and interest around an issue is really effective. We got national news media attention. We got a lot of folks involved. And so I think we're going to queue up a video here in a second. You're going to see a little bit about what that was like. And then we're going to hear from Jeanette Rousey, and she's going to talk more about that experience. So can we bring up that video? We're all learning the new tech. Okay, I think I'm going to hand it over to Jeanette and let her talk a little bit about the experience of the insulin caravan and organizing towards that. And we might be able to show that video a little bit later. So Jeanette, are you ready to talk?
Yes, I am. How are you all doing today? Thank you, Savannah.
Great.
I believe I have some pictures that are going to come up on the screen. And maybe somebody can give me an audible cue when you see a picture of me, and I will...
They're up. Got a beautiful picture of people with a banner.
Wonderful. Thank you so much. I'm Jeanette Rousey from Huntington. I'm a self-employed public relations consultant, and I am the 5th person on the right in the picture that you see, right beside Barbara Fleischauer. Savannah, I believe, is on the right-hand side of that picture as well, and it was a pleasure for me to be part of the Insulin Caravan to Canada. I work with nonprofit groups that serve children and families, and I've also been a volunteer activist for the past few years with various grassroots groups, and healthcare is a huge concern for me as well as it is for everyone. So the Caravan to Canada was a wonderful springboard in terms of bringing the issue to statewide attention. And Barbara Fleischauer and a number of volunteers organized this. It took months. The trip itself happened about a month before the beginning of the legislative session, and I went to learn as much as I could to help spread publicity in social media. And as the coalition grew and prepared to advocate for the insulin copay limit, it was just really exciting. And I'm going to just share a brief show and tell about how a whole lot of West Virginians took this journey together. So you can see some of the different ways that people volunteer and can make a real difference in meeting our healthcare goals. So the next image shows me and several other people, including our own Kim Jones. As soon as I returned to Huntington in early December, I was able to reach out via Facebook and through friends and others to find families who would benefit from the passage of an insulin affordability law. So this picture is of a press briefing and a Facebook Live video interview that I conducted with Tia, who's a single mom in Huntington, and Kim, who graciously sat down to be interviewed to talk about their experiences and what they would like to see. And it was really informative. Personal stories, as has been mentioned, are the most powerful tool in making legislative or any kind of strategic change. And we were really fortunate as a result of this event that the newspaper ran a really good story, and that led to identifying some more people who called me or who reached out and cared a lot about this issue. So on the next picture, this is in a stairwell at the state capitol building in Charleston, and this is a nice-sized group of West Virginians from all walks of life, many of who were making their very first trip to the Capitol during the legislative session to act as citizen lobbyists at various points during our 60-day legislative session. And our own Savannah, the House of Delegates legislative sponsors, including Delegate Fleischauer and Delegate Hill, and other leaders in this effort provided the training, kind of taught people on the fly, and helped prepare people to feel comfortable telling their stories. And then they helped us navigate small groups through the building and through the 60-day legislative calendar as the Insulin Affordability Act made its way along a really bumpy and really challenging journey. And I didn't have personal experience there in the case, but I volunteered as much as my time allowed during the session by making phone calls to legislators, sending emails, posting updates and pictures to our Facebook group, driving people to the Capitol, and helping people find legislators' offices, because it's kind of a maze there. Even if a person could only make 1 or 2 phone calls, emails, or visits, there were, as Savannah mentioned and Kim, there were enough people on our team that someone was always in the right place at the right time. And on the next picture, this is a picture at a bipartisan press conference in the Capitol, and it was well attended. It was organized by the delegates. It got great coverage, and here was one of our secret weapons, this very poised young boy who shared his own experience with type 1 diabetes. He and a number of others, including Kim, so many others, spoke up at the press conference, answered questions of the legislators, and joined teams to talk with individual legislators, and made a huge difference. And if a kid can do it, you can do it too. Are we seeing the picture of our young lobbyist?
No, we're still on the stairs. Oh, there he is.
Oh, okay.
We're
There
good.
we go.
Oh,
No.
okay, there he is. So there he is, and he was just amazing. He went and, had a suit on every time he was there, and he really impressed the legislators, not only with his poise, but with his lifelong experience with diabetes and just telling his story. And, he just was, I see him being in the legislature himself one day. He was just wonderful. So on the next slide, it shows how we were equipped with our handouts and our roles as team members. We grouped up in teams of, 4 to 5, 6 people, and we made our way to visits at different points of the session, depending on where the bill was, with delegates and senators. And in this picture, I was serving as a note taker and a picture taker. And this was, the lady on the right was Senator Sue Klein. And she was, to us, maybe an unlikely ally. And this really proves that it's really important not to take partisan assumptions with you, because you never know when a conversation with a lawmaker or even with their administrative assistant would open the doors to more conversations. And that was really important, especially when we had some really crucial moments during committee meetings. And this bill was, I think, triple referenced in both the House and the Senate. So it took about as many twists and turns as it could. But there would be these really critical moments during committee meetings when a patient or a family member would be called upon to share information. And that person being there and being able to answer those questions and tell those stories kept that bill moving. And these folks were the real champions. And like him, they weren't public speakers. They were just people who cared, and it came through in those stories. So the next picture, we were almost amazed. I was kind of amazed that this thing was like it would be on the verge of death and it would come back and come back. So even those legislators who, despite many meetings and calls, wanted this bill to die could not overcome the momentum of people who were personally invested. And this spilled over to news stories. So several reporters and TV stations kept this issue in the public eye, and this helped us grow our Facebook presence and our army of volunteers who could make phone calls and send text messages and emails at really pivotal moments. So here's one of my Cabell County neighbors, Alan. He's a pharmacist, retired pharmacist, and a longtime type 1 diabetes patient, and he was being interviewed by Channel 13 there at the time. So as it's been alluded, we had a happy ending. So the very last picture shows because of hard work, because of good communication, a good bit of luck, and a whole lot of people who cared and showed up, called and wrote their legislators, the bill passed. Even though the copay cap ended up being higher than we originally were proposing and hoping to see in the original version of the bill. So the final roll call, was showed, and we celebrated. So you can see it was almost unanimous. And this just brings me kind of to the last role that's really important for the right person is writing thank you notes and sending emails, not only to the legislators who voted your way, but to the administrative assistants and the other staff who provided help, because they were really important. They would make copies of things for us, and, on both sides of the building, both sides of the aisle, they were, we had a lot of people who personally connected to this issue. So I just want to close by saying how gratifying it was for me to be involved in the insulin affordability push, not only because we won, which was wonderful, but most of all because of the volunteers who became teammates in this journey. And, we built a lot of skills together, and, we know that we can do this again. So thank you all.
Thanks so much, Jeanette. I think next up we have Kat Stoll, our policy expert, who's going to talk about some of the issues on our agenda for 2021. Kat, are you ready? You might need to unmute yourself.
Okay, can you hear me, Savannah?
Yeah, and I think we're ready for your PowerPoint also. So you can pull up those slides for Kat. Great.
Okay. I don't think I'm going to be able to see the PowerPoint, but we'll work together to track along with this. First of all, I want to thank Kim and Brooke and Eve and Savannah and Jeanette. And Jeanette shared so many valuable lessons about how to achieve a health agenda and a set of goals in the state legislature. What I'm going to talk about is what are we going to fight for and what are we going to win in January 2021. So we have drafted our health agenda, but it's not final. And what this section of our call is about in our meeting is to get your input on our draft. So I just want to comment on one thing Jeanette said. When you look at the federal level at Congress, there is partisan gridlock. Republicans don't work with Democrats very often or very well. And in the state legislature, I think we have some very good opportunities to see both Republicans and Democrats work together. And the COVID-19 pandemic is probably going to make that an even stronger opportunity because we all see the need for affordable health care during the course of this pandemic. If you can go to my second slide, please. Go on to the next one. I guess you're there. I've got a little lag time here. I want to talk a little bit about Medicaid. You've heard from Brooke and Jeanette and others, and Savannah said some things about how important Medicaid is to West Virginia. I just want to highlight a couple things. You may not know that 1/3 of all West Virginians are on Medicaid, so it's critical to our state for access to health care. And it has been the single most important tool as we have responded to COVID-19. And our DHHR, our Department of Health and Human Resources, has really done a great job of changing policies in Medicaid so that more people can get on and stay on it during the epidemic. It also helps our economy. When the state spends money on Medicaid, we get a federal match, and that federal match is quite significant. So you get new federal money flowing into the state, and that actually generates jobs, economic activity, and supports our rural health providers. And especially during this economic recession being driven by COVID-19, those federal dollars are extremely important to our state. If you go to slide 3, I just want to also mention the importance of the Affordable Care Act. Because of the Affordable Care Act, we were able to expand Medicaid to more people at higher income levels. And in fact, 150,000 more people are now on Medicaid. As you also know, there are premium subsidies in our marketplace, and there are really important consumer protections, such as those for people with a pre-existing condition. And by the way, COVID-19, if you have it or had it, it will be a pre-existing condition that you'll still have that protection if we keep the Affordable Care Act. I want to just take a little commercial break to say that our Attorney General, Patrick Morrisey, here in West Virginia, has signed our state onto a lawsuit which would repeal the entire ACA, and that is exactly what it says in the petition to the Supreme Court. And that case is going to be heard probably next year, but we have a petition and we would like to demand that Patrick Morrisey take us off this lawsuit. We need the Affordable Care Act in West Virginia. The Affordable Care Act gave us the lowest reduction, or the highest reduction in uninsured of any state in the country. You can go to West Virginia, it's WV, togetherformedicaid.com, not .org, but .com, but WV, Together for Medicaid, and sign a petition asking Patrick Morrisey and the legislature to get us off a lawsuit to repeal the ACA. It makes absolutely no sense for West Virginia. You could go to slide 4, please. So I've said a little bit about Medicaid and the Affordable Care Act. The reason I have is because the beginning of our agenda, our draft health agenda for 2021, begins by stating that we will oppose any efforts to cut Medicaid. And it goes on to say we'll oppose any efforts to repeal the Affordable Care Act. And there you can see, again, West Virginia, togetherformedicaid.com, you go there, sign our petition asking Patrick Morrissey to not put us, continue to be part of this lawsuit to repeal the ACA. So then when we get to the next part of our health agenda, and it's not a long document, we want to move forward. Those were items that are really defensive, but we want to move forward and go beyond just protecting Medicaid and the ACA, although that's challenging. Don't get me wrong. We need all of you to help us with that. We have identified 7 legislative goals that we'd like you to think about. And we're going to try to have a little fun and interaction with this. We'll see how it goes. I am not the best at technology, but what I'm going to do is run through the 7 goals in our draft legislative agenda. And I'm going to briefly describe them, and then we're going to give you a chance to vote. And you'll be able to vote 1 to 5. I'm not sure what that is. I don't think it's my phone, but I'm sorry if you're hearing some feedback. 1 to 5. 1 is least important, 5 is most important, so bigger is better. The way that you can vote, and I'll go through this again as we do each of the legislative goals in our draft agenda, is that you can use your phone, and when you're cued or prompted, press 1 through 5. Again, 5 is most important. And don't just vote 5 for everything. You can if you want, but try to give us some guidance on what is important. If you're not on by phone, you can go to Healthcare for All West Virginia. It's all one word. West Virginia is abbreviated. So healthcareforallwv.com. All one word, no caps. .com again. And you can tell us what your priorities are among these 7, and also tell us other things that we ought to add to the agenda. You can also respond on your Facebook live stream. Okay, so let's go through these agenda items, give you an idea of what we prioritize, and see what you think. Okay, so let's go to slide 6, please. So our first legislative goal for 2021 is to create a children's health insurance choice program to close coverage gaps for children. You may not know, but there are still some children in our state who do not have health insurance. They are above the Medicaid and CHIP, Children's Health Insurance Program eligibility levels. So what this will do is allow folks to buy into CHIP who do not have a source of affordable insurance coverage. And we think that's a real important step so that we can get to 100% coverage for our kids. Okay, now you get to vote. If you think this is important, 1 to 5, 5 most important, please rate how you feel about it. And the way you do that is on your phone. You can press 1 to 5, or you can go to healthcareforallwestvirginia.com or do it on your Facebook live stream. Are we queued up for that? I hope so. I'm just going to pause for a moment to give everyone a chance to sort of get with the program, if you will, and vote. Again, 1 through 5. 5 is the highest. You can do that on your phone. You can go to our website, or you can do that on Facebook. Okay, well, I hope that worked, and I hope you had fun with it. If not, you can still go to healthcareforallwestvirginia.com and give us some feedback. So the second, let's go to the next slide. That would be slide 7, just to help the folks who are advancing this. It says, 2, this is our second goal, create a Medicaid buy-in program to increase choice and improve affordable health coverage options for adult West Virginians. Basically what this is you could, no matter who you are, if you don't have affordable employer-based insurance, you would have the choice to use your premium tax credit or subsidy that you get on the state marketplace and buy into Medicaid. Medicaid is great coverage. So this is really just a way to give you another more affordable and more comprehensive health insurance choice on our marketplace. So let's vote again. You can use your phone, go to our website, or enter a response on Facebook. on a scale of 1 to 5, how would you rate the importance of creating an affordable Medicaid buy-in coverage for families who make too much to qualify for Medicaid? Again, 5 is most important. And I'll just pause for a moment while you do that. And please do give us your input. It gives us an idea of what is most important to folks across the state. And of course, we also want to hear if there are other things we should be fighting for. So let's go ahead and go to slide 9, which is number 4, expand the vision care benefit for Medicaid-enrolled adults. Well, this one's pretty self-explanatory. Right now, adults in Medicaid do not get eye exams or glasses covered, and we feel that like dental coverage, which we gained in the last legislative session, this is critical to being a good worker, to getting a job, to parenting success, to being safe and being able to take care of yourself. It's low cost, and it's just common sense that people on Medicaid, adults, should be able to get an eye exam and eyeglasses. Okay, so let's vote on this one. Again, use your phone or go to our website, healthcareforallwv.com, or on Facebook in the comments. On a scale of 1 to 5, how important is this? 5 being the most important. Bigger is better. Okay. I'm going to just check in. Savannah, is everything going okay? Are people able to hear? And as I don't have a video feed.
Things seem to be working okay on this end.
Great. This is what happens when grandmas do technology. They get insecure. And of course, at any moment,
we need to move towards wrapping up, though, because it's 6:50. Just a time check.
Okay. I'll go through the rest quickly. The 5th goal is regulate high prescription drug prices and increases to save money in PEIA and Medicaid. Last legislative session, we passed a prescription drug pricing transparency bill. So now we'll know more about how drug companies and insurance companies price drugs. Now we want to take the next step and move towards regulation with an affordability board. Okay, let's rate that. 1 to 5, you've got the drill here. Use your phone, our website, or Facebook. Okay, let's go to the 6th goal. Enact paid sick and medical leave and paid family leave for West Virginia workers. I think this is pretty obvious, too, and we've really seen it demonstrated by COVID-19. We should not be forcing our families to choose between keeping a job or having income come in, having a day off to care for a sick child, or losing their job. We need paid sick and medical leave and paid family leave for West Virginia workers. So let's vote on this one. Again, use your phone, the website, or Facebook. 1 to 5, 5 the most important. And last but not least is number 7, improve how Medicaid addresses non-medical factors that impact health for Medicaid-enrolled families. This is social determinants of health by another name. Housing, transportation, food, education. There are a range of non-medical factors that we know with common sense knowledge impact how healthy we are. And we would like to take a first step towards making sure that Medicaid addresses some of those issues as well as medical factors. It's a small first step. It's a public-private task force, but it's extremely important that we start to say, if we want you to be healthy in the long term, we need to look at your housing, your food, your education, and give you help with all of those kinds of things, those non-medical factors that influence your health status. So let's vote on that one. It's the last time you get to vote. You know the drill, 1 to 5. Okay, I'm just going to skip through a couple slides here because I think Jeanette and others have done a wonderful job of telling us how important it is that you share your stories with our campaign. But if you can go to slide 14, you'll see there a website where you can go to share your story and have our story collector reach out to you. You control the story. You can remain anonymous and share your story or work with us to be part of our storyteller bank to help change policymakers' minds. There is no more important advocacy tool. All my wonky stuff doesn't count without stories. That is the most important thing. And finally, I get to make one more ask of you. It's really important right now, and I don't even have a slide for this, but we have a tremendous need for federal fiscal relief to help our state with its state budget, and that's true of all 50 states. We need you to reach out to Senators Manchin and Capito. You can do it on Facebook, Twitter. You can call their offices. If you Google Manchin and Capito, you'll find their information. I'm sorry I don't have a slide here. But we need them to support a COVID-19 fiscal relief package like the one in the House, one that increases the federal Medicaid match and gives states money that they can use in different ways that has flexibility to help us withstand the impact of the COVID-19 economic recession. So that's an ask we have now. If you join our mailing list, you'll hear more about that ask. That's unfolding in Congress right now. And while the House passed a wonderful package of fiscal relief for families and states, the Senate hasn't done much yet. But we believe Senator Manchin and Capito can be moved to be in the right place on this issue. And that's it, folks. I hope I didn't take too much time. I didn't want to talk too fast or rush through that polling, those polling questions. Thank you, Savannah. I'll turn it back over to you.
Thanks so much, Kat. Great job. Lots of exciting prospects for next year. And I'm going to turn it over to Kim in a second to wrap us up. But before I do, I just want to invite everybody to tell us what was missing from this platform. What have you been thinking about that you want to see change about our healthcare system that we might be able to change in West Virginia at the state level that you want to see us working on? So could be anything. And the ways that you can tell us that, or you can if you're on Facebook, you can go ahead and put it in the comments. You can go to our website, healthcareforallwv.com, and take the survey on our website to give input. Or you can press *3, and that will take you through to someone who can collect input from you over the phone. And we really want to hear what you think about what's missing from this agenda, because we want your help in getting this work done, and we want to make sure we're working on the right stuff. So with that, I'm going to turn it over to Kim to close us up.
Thank you, everybody. That was wonderful. I really loved to see how it all came together, even though this wasn't the town hall we were planning in January. We all did well with the virtual. One thing I have to mention is, obviously for us, we think this is a social justice issue. We don't just think it's something practical. It's every person deserves health care. And as we've seen, particularly with COVID-19, that a whole lot of people are not getting the same level of care as us, particularly people of color. And I think right now we're seeing as if we needed any more evidence of how people of color don't have the same advantages as other people. So I just have a quote for you, and keeping all of our friends and loved ones in mind. Justice is indivisible. You can't decide who gets civil rights and who doesn't. That's Angela Davis. So thank you everybody for coming. Now we're going to kind of ask you what you might be willing to do, or what you might, find yourself willing to take on to work for us and to help make our goals reality. You could make phone calls for us. You could survey community members. You could share your personal health care stories or lobby for better policies. because it's going to take all of us. I mean, that's what we discovered in what we did this session. One or two people can't do it all. We need hundreds of people. So in any way you can help us, please reach out to us. We'll be happy to answer any questions and get you on board. And if you want to learn more, please visit us at www.healthcareforallwestvirginia.com/join if you want to volunteer. So I'd like to thank West Virginia Citizen Action, West Virginians for Affordable Health Care, West Virginia Center on Budget and Policy, and all of our panelists, Savannah, Bonnie, Eve, Kat, everybody that participated. Thank you for being with us, and we appreciate your time. Good night.